My name is Ade. I'm 45 years old and I live in Seattle. I was diagnosed with Wilson disease in 1994 when I was just 14 years old. My diagnosis was entirely coincidental. I had no visible symptoms at the time. It was discovered only because of an abnormal liver function detected in a routine blood work. In many ways, I consider myself incredibly fortunate. Yet, I also worry deeply for others who may be with Wilson disease undiagnosed, simply because their symptoms have not yet manifested or have gone unrecognized. This is why I believe so strongly in the need for a standardized test for Wilson disease, one that could be administered to newborns. Early detection could dramatically improve outcomes and reduce the emotional and physical toll of a delayed diagnosis. Over the years, I've been prescribed three main medications: penicillamine, zinc therapy, and Trientine. Each came with its own challenges. I started penicillamine at diagnosis and stayed on it for more than 15 years. At first, it worked well, but after moving abroad to China, where I live and work for several years, I couldn't always access routine checkups. Specialists were rare, and I had to travel to another province just to see a doctor, which means I was only tested about twice a year. That gap made it difficult to tell whether penicillamine was losing effectiveness gradually or suddenly. By the time I returned to the US and resumed regular monitoring, it was clear the drug was no longer working. My care team increased the dosage for a time, but ultimately the decision was made to switch. The next option was zinc therapy. I lasted on it for about a year, but from the very beginning it was miserable. I had severe gastrointestinal issues, nausea, stomach pain, and overall gastric distress. My doctor tried to help by suggesting I adjust the timing of my doses, but nothing made a difference. Because of the side effects, I sometimes skipped doses, which only made things more complicated. Eventually, my doctor and I both agreed it just wasn't sustainable. The next one, I moved on to Trientine. Compared to zinc, it was a relief. No major side effects, but it brought new sets of logistical hurdles. Trientine had to be taken between meals, which turns every day into a scheduling puzzle. I need to take it three times daily, at least 2 hours after eating or an hour before the next meal. Lunch to dinner is manageable, but breakfast to lunch is always a challenge. If I forget or if something delays a meal, the entire schedule has to shift. I've had to set multiple alarms just to remind myself to take my medication, even late at night. It also means saying no to late dinners with friends, skipping snacks, and sometimes feeling guilty when social plans revolve around food. On top of that, most forms of Trientine requires refrigeration, which complicates delivery logistics and making traveling even more stressful. I've always have to check whether the hotel that I'm staying has an in-room refrigerator or not, and worry whether the medication stayed cold during the flights as well. At one point, I was part of the clinical trial for a new oral medication. To me, it felt like a breakthrough. It worked so well that even at the half standard dose, I was flushing copper very effectively, with minimal side effect. I thought this could be the answer I've been waiting for. But after several extensions, the company ended the trial and stopped developing the drug. The decision was devastating. It felt like the rug has been pulled from under me, like the dream solution had slipped away. Alongside medication, I've also followed low copper diets since my teens. Giving up favorites like chocolate, nuts, shellfish, even mushroom was painful, especially as a teenager when my peers seemed to free to eat whatever they wanted. My parents were supportive in their own way, sometimes even giving up certain foods themselves, though they occasionally downplayed the restriction and said I could cheat once in a while. Now, as an adult, I recognize the risk more clearly and avoid those foods completely, but the longing for them never fully goes away. Recently, an MRI showed copper accumulation in my brain. Looking back, I feel fortunate to have caught Wilson disease so early, but I also feel the weight of its daily demands. I hope for a future where treatments are more flexible, accessible, and forgiving, where medications can be taken with food, remain stable at room temperature, and stay effective long term. I imagine a life where patients don't have to set alarms, rearrange their social lives, or feel guilty about craving chocolates and mushrooms. That's why I urge for greater investment in research and development, because people with Wilson disease deserve more options, fewer restrictions, and a better quality of life. Thank you.